Okay, so 1 in 5 people in the US currently use this, and most people don't actually understand what it is, and it's at risk of being cut back. Yeah, that's right. We're going to talk about Medicaid. Okay, so at its core, Medicaid is a government-funded health insurance program specifically for lower-income people. I don't know why I'm looking at my screen. I don't even need it. It's so often confused with Medicare, which is also a government health insurance program, but that's mostly for people over the age of 65. So when you're thinking about Medicaid, really focus on the aid part of this whole equation. It's unfortunate that those names are so similar, but I didn't make it up. It was signed into law back in 1965 by President Lyndon B. Johnson after a really long and hard-fought campaign by organized labor unions and liberal Democrats who historically have been good about these things, and they just wanted to provide an alternative for an already established private healthcare system. The US, as we all know, is very different from other countries. If you paid any kind of medical bill, you know it's really expensive, and that's because we rely on a private healthcare system as opposed to a publicly funded one, like a lot of other countries do. Medicaid now covers over 72 million people all across the country in all 50 states, red or blue, doesn't matter. People all around the country are covered by Medicaid. Nearly half of all children are on Medicaid. It helps keep things like hospitals open. It pays for a huge chunk of the population to get long-term care, and at this point, most Americans support it, just like you, right? So yeah, that's Medicaid in a nutshell, and the reason we're talking about it is because there are some pretty messed up people out there, like our current administration, that are hoping to cut it back by over $500 billion over the next 10 years. And I think that's crazy, because if you're going to use over $500 billion, you should maybe use it on healthcare. That could potentially impact millions of people who are already struggling. So that's why we're starting this. We're starting this series just on Medicaid, so we can take this big thing that you hear about a lot and you don't really understand and just bring it to you and break it down and make sure you have the information you need. So if you got any questions, drop them in the comments. We want to hear from you. We want to answer as many as possible. And drop a like if you like this video, because I like talking to you. Stay safe out there.